Hi, my name's Anne Hagell, and I'm the research lead at the Association for Young People's Health. And we're a charity that promotes better understanding about young people's health needs and youth-friendly healthcare. So I'm going to talk to you today just some thoughts on the underpinnings of youth-friendly primary care. So these are the things that I think it's important to cover. I want to begin by explaining why we think it's so important to invest in young people's health, why it is important to do this in the first place, and then to move on to talk a bit about young people and health inequalities and primary care, because there are such key issues there and a primary role for primary care. And then to think a bit about what youth-friendly primary care services actually means, what are we talking about in practice, and finally to end with some readings and resources. So this is always my starting point. It's the reasons to invest in young people's health. It's the underpinning really for all the work that we do at AYPH. And where we often start is just by pointing out that there are 11.6 million young people aged 10 to 24 years, and they represent 20% of the UK population, a really significant slice. This is a key age for developing health behaviours, in particular things like diet, exercise and substance use. These things are set in motion at this age. It's also the peak age for many long-term health conditions, such as, for instance, 3/4 of mental health, long lifetime mental health problems will start during this age period, but also other things like the peak age for diagnosis of type 1 diabetes. It's an age defined by transitions to adulthood, in education, in living arrangements, in relationships, and transitions are levers for change. They are points which you can change people's trajectories, and this age range is packed full of them. So it gives us masses and masses of opportunity for really making a difference to people's lives that will last them a lifetime. And the investment reaps rewards now, but also later, and not just for us and as a nation and our investment in the health service, but also for young people themselves, of course, and their quality of life. One of the really key things that underpins the importance of primary care in health across the age range, but also with young people, is its role in helping with health inequalities. And the two groups of inequalities that we particularly look at for young people are these two: economic deprivation, such as family poverty, youth unemployment in the 16 to 24 age range, for instance, insecure work, student debt, other kinds of debt, all of those things, economic deprivation in the neighbourhood, but also the social circumstances that young people find themselves living in. So this may not necessarily mean economic deprivation, but they will be put at a disadvantage by the fact that they are looked after children, they're young carers, they come from certain ethnic groups, they fall into LGBTQ groups, or they're young people with learning disabilities, and many, many more. But there are many groups of young people where we have to just watch out to make sure that they have equal access to services, because that is one way of us targeting health inequalities. So this slide just represents really some of the health inequalities that we can already see emerging in our age group. This is taken from our publication Key Data on Young People's Health. You're welcome to take a look at that online if you like more information about this. But another thing to point out about health inequalities in this age group is that we are very concerned that the implications of the pandemic for young people may be exacerbating health inequalities. So this is a very timely issue. So moving on to think more about youth-friendly primary care services and what that actually means in practice. So we know that youth-friendly primary care can improve young people's perceptions of and engagement with health services, which of course is critical at this age when they're developing lifetime habits, including how they interact with health services. And these are the characteristics that we know work for them. So involving young people in service design and in reviewing services is critical. You're not going to know what they need, how it appears to them, what their feelings are about it all, unless we actually involve them. And that might be at the outset if you're designing a new service, or it might just be regularly if you're reviewing what you're delivering. We are, in our experience, you can't second guess what young people are going to say, not all the time at any rate. A second really key issue is explaining confidentiality and consent to young people, and that means practitioners knowing what the rules around that are. So understanding when you can and can't talk independently to a young person without the parent being present, and making sure that young people have confidence in you in terms of confidentiality and when you will or won't share information that they give you. Making young people welcome can be as simple as having information that is for them available in the waiting room. This is often not very obvious. Often GP waiting rooms won't seem like they are really for young people at all. It is key, but it might also be making them welcome in the sense of providing services that fit around their lives, around school times, having drop-in clinics perhaps once a week, things that we know young people find much more accessible. Providing relevant health services is important, so things that actually speak to the issues that they're likely to come with, such as sexual health services, such as information about what to do if you are developing a lifetime health problem that you're going to have to manage yourself, and other things that are directly relevant to their age group. Developing staff skills and training is important, and partly that is just about understanding the life stage. And a part of GP training, actually understanding adolescence isn't terribly high up the agenda, but it is really critical to know what is happening and then how to communicate and develop trust with this age group, which is really a particular skill, but not one that's impossible to learn. And knowing how to link with other relevant services. And the voluntary sector provide many relevant services for young people, including, for instance, those sexual health services, and knowing what is available in your area and how to help young people find it. Really, I mean, apart from anything else, it takes the weight off the GPs, but it really helps young people. So I just wanted to share with you two examples of very youth-friendly primary care that we've been involved in at the Association for Young People's Health. And they're ones that you may have heard of. They're worth looking up. They vary in terms of how long they've been around. The Well Centre is very well established. It is a GP service specifically for young people. It was set up alongside a youth service in South East London. It's in Streatham, and it's run by GPs, and in fact youth workers provide some of the reception services there. It caters to a fairly wide age range, but the core is probably around about 11 to 19, and they have drop-in. They have very good relationships with local mental health services, and CAMS does outreach into the Well Centre and helps them pick up those cases. It has been so successful that other GPs in the area refer young people on to the Well Centre when they feel that they need to be seen by people who really have expertise in the age group. And one of the founding GPs, Steph Lamb, and I wrote a paper about the early years of the Well Centre and the kinds of client group that they saw going through there, and the reference to that is on the page at the end of this talk. And one of the really key things that we found at the Well Centre that was a very significant number of the young people who dropped in were not actually registered with GPs anywhere, and they also get quite a lot of young people who are living in unstable housing, so sofa surfing with friends, and these are really important groups to reach out to in terms of primary care. HealthSpot is in reach into a youth service in East London, and this is run by two GPs from a GP hub in Tower Hamlets, who run a clinic at the moment once a week. It actually started during the pandemic, so at the beginning they've only been able to deliver remotely, which has been quite interesting, and AYPH is involved in evaluating how this is going. One of the really interesting things is how many relationships have to be made in the local community and the local service provision to make this kind of thing work. For really good, holistic, youth-friendly health services, you need good relationships with other people also delivering health services in the area. And so HealthSpot is a bit of a watch this space at the moment, but lots of really interesting things to learn from their efforts doing that. And it's very similar to the Well Centre in that young people have been really fundamentally involved in setting it up and helping the GPs to understand what it is that's going to work for them in terms of improving access. So I've just put up a few references on there, including the paper that I did with Steph and some work that we've done at the Association for Young People's Health on how to provide health services across the 16 to 25 age range, which is really interesting, I think, in primary care terms. And some classic papers dating back to that one from 2007. We do know, in a sense, what works in user-friendly primary care services. It's just that it's been difficult to roll it out. But some of it can be done, I think, with relatively little change to what's happening at the moment, apart from a sort of change of thinking and approach and being able to see things through the eyes of those young people. And I would recommend to you the Royal College of GPs Adolescent Health Group, which is a really passionate group of GPs who work with the college to improve and help and support colleagues who want to deliver more youth-friendly health services. And their website address is on there, but you will find that if you just put RCGP Adolescent Health Group into the search. And in fact, as you are doing your training this afternoon, I'm presenting at a conference that is organised by the RCGPs. So their events are definitely worth watching out for as well. So thank you very much for having me, and I hope you have a lovely afternoon doing more training. And it is always wonderful to hear that there are GPs out there who are interested in learning more about youth-friendly primary care. So I can't meet you in person. I would have done if I could, but very nice to be here anyway. Thank you.